What is hypoxia? Hypoxia is a condition where tissues in the body don't receive enough oxygen to function properly. It's important to distinguish between hypoxia and hypoxemia. Hypoxia refers to low oxygen levels in tissues, while hypoxemia specifically refers to low oxygen levels in the blood. Hypoxemia can lead to hypoxia if the blood can't deliver enough oxygen to the tissues. But hypoxia can also occur when blood oxygen is normal, but tissues can't properly utilize it. Let's explore normal oxygen requirements. Healthy tissues typically need oxygen levels between 20 and 70 millimeters of mercury. When oxygen levels fall below critical thresholds, typically less than 10 millimeters of mercury, cells begin to malfunction and can eventually die. There are four main causes of hypoxia. High altitude exposure results in lower oxygen pressure in the air, making it harder for your lungs to capture oxygen. Respiratory diseases like COPD, pneumonia, and asthma impair the lungs' ability to transfer oxygen into the bloodstream. Cardiovascular problems such as heart failure, shock, or pulmonary embolism reduce blood flow, limiting oxygen delivery to tissues. Anemia decreases the blood's oxygen carrying capacity as there are fewer red blood cells to transport oxygen to tissues. When oxygen levels fall, the body activates several compensatory mechanisms. The breathing rate increases to take in more oxygen. The heart beats faster to circulate blood more quickly, and blood vessels dilate to improve oxygen delivery to tissues. At the cellular level, hypoxia causes a cascade of effects. A normal cell produces energy efficiently through aerobic metabolism. In contrast, a hypoxic cell struggles to produce energy, shifting to less efficient anaerobic pathways. This leads to decreased ATP production, cellular swelling, and eventually, if prolonged, cell death. Understanding hypoxia is crucial for diagnosing and treating conditions where oxygen delivery or utilization is compromised. Hypoxia presents with a range of symptoms that progress in severity as oxygen levels decrease. Mild symptoms include headache, shortness of breath, rapid heart rate, and fatigue. These occur when oxygen saturation is between 90 and 94%. As hypoxia worsens, moderate symptoms develop, including cognitive impairment, coordination difficulties, increased breathing rate, and anxiety. This typically occurs when oxygen saturation falls between 86 and 89%. Severe symptoms represent a medical emergency and include confusion, blue discoloration of the skin and lips known as cyanosis, loss of consciousness, and cardiac arrhythmias. These occur when oxygen saturation drops below 85%. Diagnosing hypoxia involves several methods to assess oxygen levels in the blood. Pulse oximetry is a non-invasive method that uses a sensor, typically placed on a finger, to measure oxygen saturation levels. Normal levels are between 95 and 100%. Arterial blood gas testing provides more detailed information by directly measuring oxygen and carbon dioxide levels in the blood. This invasive test gives precise measurements of PaO2, PaCO2, and pH, allowing for assessment of both oxygenation and ventilation. Treatment of hypoxia focuses on improving oxygen delivery and addressing the underlying cause. Immediate interventions include supplemental oxygen therapy, which can be delivered through nasal cannulas, face masks, or in severe cases, mechanical ventilation. Patients are often positioned upright to optimize breathing mechanics, and any airway obstructions must be cleared promptly. Treatment varies based on the underlying cause. For altitude-related hypoxia, descent to lower elevation or pressurized cabins are effective. COPD-related hypoxia may require bronchodilators with carefully controlled oxygen. Pneumonia requires antibiotics along with oxygen support, while respiratory failure may necessitate mechanical ventilation. Prevention of hypoxia focuses on anticipating risk factors and taking appropriate measures before oxygen levels drop. Key prevention strategies include using supplemental oxygen during high-altitude activities, maintaining proper management of underlying respiratory conditions, and implementing regular monitoring for patients at risk of hypoxia. Recognizing early warning signs is crucial. These include increased breathing rate, mild headache, unusual fatigue during normal activities, and shortness of breath. Responding to these signs early can prevent progression to severe hypoxia. Additionally, avoiding respiratory depressants such as alcohol and sedatives is important, especially for those with underlying respiratory conditions or during high altitude exposures.